experience that you have in airlines, in banking, in retail, in service, and every other part of our world are really not replicated yet in healthcare.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today, we have Don Woodlock, InterSystems VP of HealthShare. InterSystems is a privately held company based in Cambridge, Massachusetts. Welcome to the podcast, Don.
Great. Thank you, Bob. Pleasure to be here.
Well, for those who are not familiar with InterSystems, I read that your mission is to keep people healthy, help businesses run smoothly, and help governments serve their citizens. And that is a pretty big order. So it sounds like a whole lot. And to do this, I understand you're intensely focused on fast, reliable access to lots of data. So, Don, is it safe to say that you're all about data at InterSystems?
That is certainly our specialty. I mean, we describe ourselves as the engine behind the world's most important applications. And we do have a special focus and long track record in healthcare. And across all of the different systems built on our platform, we have hundreds of millions of patient records basically stored in our customer systems, but stored on our technology. And so we're very familiar with the importance of data, the importance of protecting it, the importance of having applications scale and be fast and reliable and that kind of thing. So we certainly have been in the data business for a long time and know how important that is to support healthcare.
Okay, so we'll kind of narrow the focus here a little bit and maybe set aside the government serving the citizens and helping the business run smoothly and really kind of focus in on the healthcare aspect of this, since this is the Business of Healthcare podcast. So you are the VP of HealthShare. HealthShare, that's a great word. Tell us more. Is that a platform? If it is, tell us about that platform and what it involves.
HealthShare is basically an EMR interoperability platform and clinical data aggregation platform. And essentially, we sell this platform to customers all throughout healthcare. So we sell it to health systems, we sell it to payers, we sell it to state HIEs, we have life sciences customers, lab customers, regional governments of non-U.S. Countries. And essentially, it allows all of these types of customers to basically integrate data from all the different sources of clinical or claims data into one place. And it builds what we call a unified care record across all these different data sources by aggregating, normalizing, deduplicating, and bringing that information together so you have a unified look at your patients or your members or your citizens, and you have a nice analytics foundation for, understanding your population or machine learning or that kind of thing.
Okay, so you mentioned this HIE, kind of for the benefit of our audience. Explain what that is.
HIE stands for Health Information Exchange. And what generally happens in the U.S., at least, is each state has some health information exchange initiative where one or more organizations are funded or supported to bring together patient data across, the hospitals and provider groups within that region. Some states don't have them. Some states have a couple. I know you're out of Dallas, so one of our key customers is Greater Houston Health Connect, and they have, I believe it's around 10 million patients in the community where they support the exchange of healthcare data among the hospitals and providers in that area.
So, Don, were
as
these
an example.
were these exchanges initiated by government mandates, part of the high tech initiative? The high tech was, trying to find meaningful use with EMRs and things, electronic medical records and things of that nature. What's the history or origin of driving this?
Yeah, it was an initiative that started before the High Tech Act, about 15 years ago, let's say. And there might have been an overall federal initiative. I'm not recalling the name of the program. But essentially, the idea was that public agencies or public funding would help create regions of interoperability throughout the country. Now, I will say that this has not been uniformly successful because some of these HIEs have difficulty sustaining themselves once the initial government funding ran out. Many HIEs exist and have found a sustainable funding model, and we have many customers like that, and some were not able to find that and folded. And so a lot of other kinds of organizations, whether it be health systems or payers or other groups, have sort of stepped up to help with interoperability in their communities. There's many kinds of organizations that really help the interoperability of healthcare data, not just public HIEs.
Very good. Well, you mentioned earlier having a unified view of information and having interoperability. So I have to mention this. In some of our courses, we show this YouTube parody, and it's called If Air Travel Worked Like Healthcare. And I don't know if you've ever seen this before or not, but it is certainly worth looking at. It's a dramatic expose on someone trying to book a flight from one city to another city. And instead of everything being easy peasy like it is today, where you can just, click, the scenario is embraced with all types of dialogue between the person trying to make the reservation and the person trying to help them. And
I do remember that. That was really excellent.
It amplifies, how insane it is not to have an integrated system in healthcare, from the record keeping to communication. The systems aren't talking to each other. There's no pricing transparency and all these different issues and problems. These are the problems that you're trying to solve?
Absolutely. We're not trying to solve every problem. The problem of digitizing within an organization. So if you're a hospital or you're a provider group, the kind of movement from paper to electronic medical records is not, at least for the U.S. market, what HealthShare is trying to do. But once you've done that, let's say, or once you have a base of digitized health information, then HealthShare is all about sharing that, bringing that together across multiple sources, making it easy for the information to flow seamlessly among the different systems that you might have or the different organizations that you have data sharing arrangements with. So that's essentially the purpose of HealthShare.
Okay. So recently, we covered a topic in one of our executive education classes. It was a health information technology class, and we really posed the question, what is your digital business model? And we tried to cover topics like the digital threats and opportunities and the competitive advantages and really how to connect using mobile and the Internet of Things. Really looking at if you do not have a digital business model, you will not move forward. So why don't you share with our audience what your perception is here of the current state of digital transformation in healthcare? And what should we be expecting to see here? If you can look into the crystal ball, at least from your strategy perspective, scanning the horizon, what do you expect to see in 2020 and even beyond?
I think just like you described, I think healthcare has not really moved that far from a digital point of view in the last 30, 40 years. If you think about it from a patient's point of view and a physician's point of view, I think those are two key stakeholders that it's appropriate to kind of focus on. From a patient point of view, digital transformation has really not taken place. From just finding what providers are in your network, sorting through that process, making appointments on the phone to try and find a provider to see, walking into that office and answering every question about your meds and allergies and your problems over and over again, and having a cumbersome process at the end to pick up your prescriptions or figure out your lab results or those kinds of things. The experience that you have in airlines, in banking, in retail, in service, and every other part of our world are really not replicated yet in healthcare.
Okay.
And if you look at it from a physician point of view, we have made the movement from paper to electronic medical records, but that has been difficult and essentially hasn't yet been successful. So if you talk to any physician, basically, that's gone through this migration, the process of getting information in where it used to be dictating a note or typing a note or something where you could communicate in your natural language, getting it into the system with drop downs and points and clicks and tabs and radio buttons, and that is still, it's a very difficult process. So I do think that from a patient point of view or a physician point of view, digital transformation, at least transformation that makes the environment much better, has not really taken place yet, unfortunately.
Yes, for sure.
But I do think one of the foundations is to get away from paper. And so that step that we've made over the past decade to adopt electronic medical records, despite it not being sort of perfect and optimized yet, was a very important step. And so going forward, I think we should see a couple things, at least ideally.
Okay.
So one is a more digital experience from a patient point of view, having it be more like airlines in terms of who are my providers, let me get an appointment for next Thursday at 10 o'clock, let me fill out, my information online before I show up. Anything that's happened to me at other physician groups, automatically this new physician knows about it. Having that experience be smooth from a digital point of view, optimize me where I am, whether it's things I can do in advance at home with weight scales or heart monitors or things like that. Having kind of the patient experience of healthcare be more high-tech and be more streamlined. And I do think that there's a lot of pointed innovation across health systems around that digital patient experience, but there's not a uniform approach that's out there or uniform success stories that the market is migrating to.
Okay.
On the physician front, then, getting information into its digital form, I think there'll be a lot of great transformation in the coming years on that. I think the most interesting is probably a more natural voice-based process where the technology can kind of listen to the office visit and automatically generate notes, generate discrete data, generate action items, next steps, orders, that kind of thing. So it's not kind of a massive data entry problem. So there's a lot of companies working on that, getting information into a digital form from a face-to-face experience. And I think the transformation on that is going to be really exciting and really important.
Yes, for sure.
And I think the last area is the area that we focus on with HealthShare is the data should be fluid. You should not have to repeat yourself twice. Information should be digitized and easily shareable. And you as a patient, as you move from caregiver to caregiver or hospital, your information should flow smoothly from one place to another. And I think that, level of interoperability and connection is extremely important to enable this transformation. So there's a lot of different elements, but I do think a digital experience from a patient point of view, a more smooth experience from a physician point of view, getting information into the system, and then having everything be interoperable and seamless and easy to share among folks that should see that information, I think are three key steps that we really need to tackle.
Yeah, I think it would be no fun at all if we couldn't enter our data in the office of a doctor several times, 4 or 5 times, and keep repeating that rinse and repeat.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
We look at the upcoming generations here. I say the millennials, actually the oldest millennial will be 40 next year. So it's not like these are children anymore, but the millennials are driving an interest in doing things differently. That user experience or the customer experience that you talk about. And we think about some of the wearables that are out there, these different devices that not only you can wear and collect data on, but also all the mobility, the Internet of Things, and ways to track and keep track and educate people from a mobile perspective. That's growing and growing and growing. So we see that as a game changer in some respects. Wouldn't you agree?
I totally agree. I think generating data as an offshoot of real life, I think, is the best way to do it. So as I walk around and my heart beats, or I, take a run around the river here, or, those sorts of things should be generating data in good, useful forms and should flow to places that need it. So I do think the mobility, the, on-patient devices, the Internet of Things, even like I mentioned, the audio from events like an office visit, just letting real life happen and then having data that's consumable and useful happen as a byproduct of real life, I think is the best way to do it versus now where real life happens and then everybody takes a break and turns themselves into data entry people.
Well, let's talk a bit about some of the disruption that might be taking place in the market. Amazon obviously is involved with a lot of things and looking at health. Mm-hmm. They acquired this pill pack company where they use AI, artificial intelligence. I don't like that word particularly, but they use machine learning and other tools that help them drive delivery to patients, the exact medication they need in a very succinct, easy format. The packet shows up and it has the time and day and what you should do with it. Instructions are all included. Amazon looks like they're making some big changes in that user experience. And other folks too, obviously CVS Health, they're opening these health hubs all around the country. They have opened some already here in Texas. I think they have plans to open 1,500 health hubs. And once again, a kind of a disruptive mode. And this kind of leads back to some of the things that we're starting to look at, like population health and value-based pricing and these integrated networks. So does your line of business start to address and bring solutions, actionable solutions into those marketplaces, looking at some of these changes that are taking place? Or is yours more the steady state, meat and potatoes part of the business? Or is this the dessert? Where do you fit in there?
A couple things. So just to reflect back on Amazon and what you were describing and CVS and the like, there's been a steady migration of care from happening, entirely in the hospital to happening where it should happen. And I think the first, 30 years of making that statement, it was around moving things from the hospital to the physician office. So an ambulatory surgery center or imaging radiology practice or more things a physician could do in the office, that kind of thing. But now it just keeps expanding, and it keeps expanding into the home environment or the social sort of care organizations within a community. And I think that's a good thing. It's best for patients and it's best for the overall value we get out of our spend in healthcare to have care happen in lots of different places in the community and not have it all be centralized in the most expensive location. And so I think folks like Amazon, like CVS, like other organizations are really pushing that concept of moving care closer to the patient home and closer to where it really should be delivered. Now, the challenge with that, which is where HealthShare fits in, is really getting that information out to everybody that needs it. And so if everything takes place in the hospital, everything's kind of easy. You have this one electronic medical record and everybody logs in and sees the information. But if care is being practiced everywhere, and it's essential for every caregiver to really see the patient's problems, meds, allergies, history, that kind of thing, then having something like HealthShare or equivalent to have the information be very fluid is important. So in a sense, HealthShare is a big supporter of the concept of decentralizing healthcare without necessarily making it very fragmented. The other thing I wanted to touch on, you mentioned machine learning and AI, and you also seem to criticize the letters AI. So my own view on AI is it really should stand for augmented intelligence, because I do think that these are terrific tools to enable anybody within a health system, whether it be a physician or a discharge nurse trying to understand the risk associated with a patient, or a billing clerk trying to figure out if the insurance company is going to pay this claim. I mean, ML is a really great technique to improve the logic and decision making of healthcare workers everywhere. But the importance of machine learning is really resting on clean data and having nice, clean, normalized, aggregated information that you can train these algorithms on. And that's also where HealthShare plays a role. So we recently announced a service called Clean Data as a Solution. And it's basically a packaging of our HealthShare technology that's focused on aggregating, normalizing this clinical data, putting it through a pipeline of rationalizing terminology or enhancing the data or making discrete data out of some of the text or de-identifying it and putting it into a form where machine learning algorithms can really work and rest on some good data. So we're also in the business of enabling machine learning to really work by having clean data as a foundation to that.
Yeah, that makes great sense. And I like your augmented intelligence, another way of saying AI, because, quite honestly, people think of AI as this all-encompassing thinking process, and machine learning really, it uses math to process input resulting in some type of prediction. And it's very, very narrowly focused. We can look at millions and millions of eyes and now predict somebody's face structure with that data, but it's very narrowly focused. So one thing before we wrap up here, I wanted to kind of get a perspective from you here, Don. I know that you do work with the government, and there's a lot of change being predicted that might take place going forward, improving healthcare, maybe coming up with a single payer solution. But when we stop and start to assess this whole idea of health information exchanges, where are we? How would you give us a score? How would you rate it on a scale from 1 to 10? Have we really mobilized healthcare information electronically across these organizations to a degree that it's starting to really make sense where we do have this seamless interaction? How well have we done, and how much further do we have to go?
I think that we have made progress with health interoperability over the past decade. So I wouldn't rate us a 0 out of 100, but I might put us like at 15 out of 100, honestly. So if I could claim a few successes of our industry, the EMR-based interoperability, Epic's Care Everywhere, and then Cerner's led initiative with Commonwealth and some of the vendor communities like Care Equality and some national networks like eHealth Exchange have really done a good job, at least within a vendor community, of having information be visible. So I don't think that was in place 10 years ago, or wasn't in place 10 years ago. And I do think that kind of brought us from 0 to 10. So we have some public HIEs, like I mentioned, and we have many, we're honored to have many as our customers. We have some EMR-based interoperability, and for instance, HealthShare taps into the Care Equality Network and the Commonwealth Network as part of our, goal to make this information fluid. So I think that's a great success.
For sure.
And I think as I look forward, we have a great standard now. It's called FHIR, FHIR, the Fast Healthcare Interoperability Resources. And what this is a new standard that should really help with interoperability going forward. And the way it works is right now, interoperability standards are focused on essentially copying information from System A to System B. So if System A wants to share data with System B, most of the time, the information is sort of set from the one system to the other and then stored. And that's an expensive way to do interoperability. What this new standard does is allow System B to ask System A, hey, do you have this patient record? Here's what I know about it. And then System A responds with the record. So it's more like systems talking to each other in real time. And it's a great new standard. We're big supporters of this standard, and it's really going to launch the next level of interoperability, I think, in our environment.
Very good. That's that publish and subscribe model where information is published and other people subscribe back to it. So that's a great model I like. And this is something new for everybody to listen to and learn more about.
Yeah, and I think the copying the information from one system to another makes people nervous. If you're a health system that owns the data for all your patients, you might be nervous sending all that data out to even an affiliated provider. But if you had more of a request response type system and you could see all the requests and you could see all the responses, you get a feel for that traffic, then there's a little bit more of a comfort level in making the information available because your affiliates have the patient in-house, they're actually taking care of them, and the level of information transfer is just what's needed and not more. So we really like this standard, and we think it's going to open up. It's both a comfort level with interoperability, and it's a great technical standard for us to build on. I think there's a lot, though, organizational and cultural challenges that we still have to work on. So essentially, organizations, whether they be payers or providers or government agencies or labs or what have you, there's still a level of maybe lack of cooperation among the different sectors of healthcare around sharing patient data. We might have great technology, we might have great standards that support the exchange, but unless you have two organizations that really want to exchange data, the exchange is really not going to happen. And so really encouraging a level of collaboration and payment models like value-based care that support that collaboration, I think is really needed to get us near 100 out of 100 on the interoperability scale.
Well, excellent, Don. I think I can wrap up here by saying it is safe to say that you are all about data. This has been a very interesting conversation. Thank you for your time today and sharing your insights. This has been very, very interesting, and we appreciate all that you're doing to help make this become more of a seamless healthcare world that we live in. So
very good. I enjoyed the conversation. Thank you, Bob.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.